Turn our attention now to some of the psychological factors post-surgery.
Yep.
Right? Someone comes in, they had the surgery, they've gone through some of the 2-week, 3-week recovery time, they're starting to feel better, and now they come to see you. What is usually presented at that point?
The first thing I hear frequently is, I'm freaking out. I can't overeat anymore. And I knew this was going to be hard, but I didn't know it was going to be this hard. And I can't use food to self-soothe. I don't know what to do. I miss my old friend, food that I've had since I was a child. The anxiety is through the roof.
Wow.
So that's sort of like the moment of reality when we really have to work to put those new coping strategies into practice.
Yes, yes.
So anxiety, depression, loneliness, anger, whatever the emotion is, they're feeling it intensely because they don't have food anymore to cope, and they're
so it's
highly anxious.
Well, it sounds similar to somebody who says, look, I'm going to go cold turkey and stop drinking.
Right? Exactly.
And all of a sudden,
yes.
what they use to cope is not there.
Right.
So what do you do with them? How do you work with them?
Well, we slow down and we start with, okay, what's the emotion that you're experiencing? Let's try to understand that emotion in all of its complexity. For example, if it's loneliness, well, let's talk about that loneliness. When do you feel it? When have you felt that way before? What words would you use to describe it? What are you wanting and needing right now to cope with that loneliness? And then we really flesh out what they're wanting and needing. Do you need to call someone? Do you need to join a group of other people who have been through the surgery for support? Is there a relationship from the past that needs to be reconciled? Do you need to get involved with a cause or an agency that you believe in so that you have a sense of affiliation? Like, I really help them try to figure out what's behind this emotion and what do you specifically need to do to address it, rather than just using food to disguise it. So we're trying to get to the root of the feeling and give like real specific strategies for coping.
I can tell by the way you're answering that question is you try to get really, really specific.
Yes.
And give them multiple things that they can do in order to address that.
Right. Instead of just saying, well, go for a jog or take a bubble bath. It's like, in your life, what is driving this loneliness and what do you specifically need in order to overcome that? And I give them a lot of support, a lot of empathy. I encourage them to really tap into their healthy, supportive relationships to get through this kind of challenging, critical period. And I help them determine which relationships are counterproductive. And I help them sort of step back from that so that during this critical emotional time, they're well supportive and they're using healthy coping mechanisms.
That's a great point, because we're assuming that they need more support. And we haven't really addressed the toxic relationships in their life.
Right.
And some of the toxicity that has caused them to get into the position they're in.
Exactly.
So
that's a big part of this work. It's identifying the unhealthy people and the unhealthy messages that drove the obesity in the first place. And it's helping develop a new network and, just sort of a healthy environment where they can take this weight off and thrive.
Can you talk a little bit about some of these unhealthy messages?
Oh, sure. The one that comes to mind that I see over and over again is your value is based on how you look. I see so many women in particular whose mothers and fathers were very invested in their size and shape and dress and how they look to the community.
Right.
And often my patients will say, my brother or my sister was the skinny one.
Right.
I was the chunky one, so I felt rejected by them. I felt like I didn't fit in. I wasn't the priority. And that just sets a cycle in motion. I feel bad about myself. I hide, I eat, I get bigger. They reject me even more. I hide, I eat, they reject me even more. And then the person ultimately ends up feeling lonely and rejected, and their self-esteem is shot.
Sure.
So we have a lot of rebuilding to do. So the message about your value being based on your appearance is huge.
Right. And particularly in this society that gets so exacerbated accentuated, right? Because such an emphasis on thinness and on beauty.
Yep.
And if you ever see some of these models in real life, right, you know how
it's skeletal.
It's skeletal, abnormally thin.
Yes.
Some of them are.
I worked with a model in one of my internship placements in graduate school, and I was shocked when she walked into my office. She really looked ill. It looked completely unhealthy and unnatural, and she was being encouraged to lose more weight.
Now, I know that there are many parents who are listening to you right now who are thinking, how do I not give that message to my daughter?
Yes.
What would you tell them?
What I would tell any parent is let your child lead you. Tune into what matters to them. Tune into what they're passionate about. Tune into their sort of authenticity and validate it and love it and respect it. Respect their whole self. Respect them as a whole person. Don't just focus on one little part of them, like how they're doing in school or how they look. Just try to get in tune with their whole self.
Because most of the time, as parents, when we're tuning into something in our kids, it's more about us than it is about them, right?
Yep.
So you're saying it's not about you, parent. It's about your child and about tuning into them.
Right. And even if your child wants to play the violin and you're an athletic person, learn to love their love for the violin. Or
because they're not you.
They're not you, and you want to really foster their authenticity. That's how a child thrives.
Who they are.
Yes, who they are, just authentically, naturally.
Right. I thought we would touch on that. Let's come back to this issue of post weight loss surgery. Are some patients at risk for example, developing bulimia or some other eating disorders?
Yes, that's not something that I see very frequently. I actually usually see the opposite, where weight is put back on.
I see.
And that's what's troubling to the patient. You know, maybe they'll initially have 100-pound weight loss, but then 50 pounds creep back on. That's the much, much more common phenomenon.
So the weight loss surgery slows down the process, I imagine. So that therefore, if one is going to gain 25 or 35 pounds, that takes longer than it would have.
Yes.
But nevertheless, it creeps up.
It often creeps up.
Okay.
It's kind of like the weight starts coming off and there's sort of enthusiasm and they're really following the nutritionist's directives and they're exercising and weight's coming off and coming off. But then over time, it gets a little exhausting to be measuring the food and to be keeping up with the exercise plan. And maybe you quit going to your support group meetings and you start grazing a little bit throughout the day and the weight starts coming back on. And then sort of the self-defeating thoughts start. And then there's a little bit more eating and then more self-defeating thoughts. And then
Give an example of a self-defeating thought.
Oh, I knew that this surgery wouldn't work. I'm just destined to be fat. I'll hear that kind of thing.
Right. I had one bag of potato chips, so therefore I've blown it. I might as well have another one.
Yep. And, or like the surgery didn't work. They must not have made my pouch small enough. It's all, this is all blown.
Wow.
Yeah. I guess I'm just destined to be fat.
Right.
Yeah.
It really highlights the importance of continuing to work with a counselor.
Yes.
Yeah.
Yes. And to really continue to work on the emotional issues that underlie that desire to overeat.
Right. Talk a little bit about addiction swapping.
Yeah. As we've talked about, many of these patients have spent a lifetime using food as a coping mechanism rather than dealing with the emotions straight on. They use food to self-soothe or to escape. So after the surgery, when that's no longer an option because of the physical consequences like the dumping syndrome, they find another way to escape. And the most common is alcohol abuse. Sometimes drug abuse. That's what I see primarily. Occasionally you'll see compulsive gambling just as a means to escape and get away and get away from food altogether. Occasionally,
drug abuse, maybe?
Marijuana use is very common because of the sedating effect. So it just really speaks to how important it is to address the underlying emotions
Right.
that are making the patient want to binge, that are making the patient want to escape.
Can you give an example of someone who you saw have that addiction swapping phenomena and then was able to break through?
Yeah, it's really interesting. I learned early in my work that a lot of weight loss surgery patients get together and drink.
Oh.
There's like this little subculture, and one of my patients was struggling with losing food as a coping mechanism. She was just sort of mourning the loss of food, and she went to like a conference, and everyone was drinking. She had never had a drink in her life, but she thought, maybe I should try this. Maybe this is what I need to get through this hard time. And she had a drink and never had drunk in her life, and was like, wow, this really does make me feel relaxed.
Right.
And I can't say she developed a full-blown addiction, but it was a real temptation for months.
Real struggle, huh?
A real struggle. And we had to work hard to address the loneliness and the anxiety that were making her want to overeat and drink.
Right. You work with so many people with some kind of distorted body image, I would imagine. So talk to us about maintaining a healthy body image.
Oh, maintaining a healthy body image. When I think about folks with an unhealthy body image, what it comes back to for me is that they have sort of reduced their identity to their physical appearance. All of their self-esteem is based on how much do I weigh, how's my hair, what am I wearing? And so that's just so risky to base so much of your self-esteem on your external appearance. So if someone wants to improve body image, or if you want to maintain a healthy body image, it's all about nurturing your whole self. It's about physical well-being. It's about taking care of yourself emotionally by getting therapy if you need it, by having healthy relationships. And on that point, it's about choosing and maintaining healthy relationships. It's about pursuing things that you love, like a gratifying career or volunteer work that's fulfilling. It's about nurturing your spiritual relationship with God. It's about just not, again, reducing yourself to one element, but working on all parts of the self and working on being a more well-rounded person, where your self-esteem points come from all different locations.
Just getting much more fully supported and becoming more balanced in all areas of life.
Yeah, nurturing your whole self.
Yeah. So briefly, benefits then of maintaining a counseling relationship as one goes through this whole weight loss surgery process.
Well, what I would say to that is, as the weight comes off, all sorts of new challenges pop up. And I'll give you a few examples. People's reactions to your weight loss can be very complex. I will often have a person tell me, my spouse doesn't like that I'm losing weight.
Wow.
They're getting a little jealous. They're getting possessive. They don't want me going out.
People start to give them more attention.
Yes, and spouses often feel threatened by it.
Right.
So that's something I see. So then we've got a relationship dynamic that needs to be addressed. I also had a case where one of my patients went to dinner with her parents and her sister, and the mom said, oh, look, and I'll use a fake name, now Sarah's the skinny one in the family.
Oh, wow.
Well, the sister didn't think much of that, and it sort of was setting up this competitive dynamic, and the sister didn't talk to my patient and the mom, and that kind of thing you don't anticipate, but it can cause a lot of distress. So all along the way, things like this, managing other people's reactions, adjusting to your new body. I have many women say, oh my gosh, like I can get into a bathing suit now. I don't know if I want to go out on the beach, and what if I look attractive? What if someone asks me out?
Tanie, let me ask you, where can people get more information? You're obviously very knowledgeable, so if you just give your website.
Oh, absolutely. It's drtaniekabala.com. So that's drtaniekabala.com.
Well, thank you so much. This
You're
has been
welcome,
very
Dave.
helpful.
It was my pleasure.
And thank you for joining us on Joy in Our Town. Until next time, I hope you have joy in your town.